The U.S. unfortunately is experiencing an outbreak of measles primarily in elementary age children. Just a few years ago, measles in the U.S. was considered to be eradicated due to a mandatory infant and pre-elementary booster vaccination program. Measles infected humans start with flu-type symptoms that evolve into a patchy red skin. That's a condition that lasts up to 2 weeks. I know, I had it. Fortunately, death occurs in only rare cases. Although very contagious to humans, our four-legged furry family members appear to be immune to the measles disease at this time. So why even bring up measles that has no medical effect on our pets? Because measles, like many other debilitating viruses, can be prevented and potentially eradicated with sound vaccine programs. Today's devastating measles outbreak in humans is an example of relaxed vaccine mandates that allowed excessive exemptions to universal vaccination programs. Religious, medical, and philosophical exemptions are currently honored, and those excessive exemptions result in higher rates of unvaccinated. With the protective barrier created by vaccine destroyed, the disease spreads to the general public. So now let's turn to our pets and vaccination programs. The U.S. is only one of a few countries offering canine rabies mandated vaccine programs for pets. There is no mandated rabies program for cats, horses, livestock, exotics, or pocket pets. With over 60,000 deadly human rabies cases seen worldwide each year, that's right, 60,000, none of those human deaths are seen in the US. So it's pretty obvious that the mandated canine rabies requirement in the US has great public health value. But what about other potentially deadly diseases in pets with vaccines available but no mandate to vaccinate? Diseases like distemper, parvovirus, hepatitis, leptospirosis, canine infectious respiratory disease complex, which is the old term for Bordetella, canine flu, canine Lyme disease, feline panleukopenia, rhinotracheitis, calicivirus, and feline leukemia all have protective vaccines available with no mandate requirement. So it's really up to veterinarians, pet healthcare organizations, and public health officials like the Center for Disease Control and Prevention to message the public of the necessity to protect their pet from these highly contagious and deadly diseases with appropriate vaccination programs. When the pet parent relaxes the recommended vaccine program and eliminates vaccinating their pet, diseases like distemper or parvo can quickly overcome an area, resulting in the sad position of many pets suffering painful deaths. So, the moral of the story, follow the instructions of your veterinarian and maintain regular vaccine recommendations, keeping your pet healthy and free from the many potentially deadly diseases. Think of complying with your veterinarian recommended regular vaccine programs, like an inexpensive health insurance policy. Thank you for watching this week's segment of Pet Talk with veterinarian Dr. Michael Fleck. Next week, stay tuned for the politically controversial issue of sperm, eggs, zygotes, and embryos and its effect on livestock and the pet world.